Dr. Holly Rizzo here, and welcome back to our lecture series in pediatric dentistry. Today we'll be discussing pharmacological management of pediatric dental patients. In a previous video, we discussed multiple non-pharmacologic behavior management techniques. So the techniques mentioned earlier are excellent at helping you work with a wide range of patients. However, sometimes even the best pediatric dentists in the world, with all the tools in their belt, cannot safely complete treatment on an uncooperative child. In those situations, there are pharmacological options we can consider. Understanding the different levels of sedation is important as these are often paired with pharmacological options that are available to children. The different levels of sedation include minimal sedation or anxiolysis, moderate sedation or conscious sedation, deep sedation, also known with IV sedation, and general anesthesia. So, the first would be minimal sedation or anxiolysis, is when a patient is capable of responding to verbal commands. This level of minimal sedation is achieved when the patient experiences less dental anxiety while their ability to respond, respirate, and cardiac function are unaffected. This can be achieved through light nitrous oxide sedation, less than 50%, or sedating medications such as a benzodiazepine. Midazolam is the most commonly used oral benzodiazepine for pediatric dental sedation. The indications for use here would be patients with dental anxiety or special healthcare needs, a severe gag reflex, and long procedures. Contraindications include patients younger than 3 years old, non communicative patients, respiratory condition patients, sickle cell patients, or bleomycin sulfate use. Moderate conscious sedation is when patients are capable of purposeful response to verbal and tactile stimuli. In these scenarios, respiration may be slowed. It's achieved through higher concentrations of nitrous oxide alone, greater than 50%, or in combination with other sedating medication, like a benzodiazepine. Indications include dental anxiety, uncooperative patients due to lack of maturity or understanding. Contraindications include patients with an ASA class 3 or higher, or elective care. Next, we have deep sedation. So, deep sedation impairs the patient's consciousness and limits response to repeated or painful stimuli. Patients are capable of purposeful response to repeated or painful stimuli. It often requires airway intervention while cardiac function is maintained. This can be achieved through substances such as midazolam, propofol, ketamine, or dexmedetomidine. These levels of sedations are often indicated for third molar extractions. Indications would be patients with dental anxiety or special healthcare needs, including extensive dental intervention. Contraindications would be a cooperative patient, a patient with a class of ASA 3 or higher, porphyria, hepatic insufficiency, minimal dental needs, or finances. Finally, we have general anesthesia. Patients under general anesthesia cannot produce any response. They're unarousable, which means that no response is produced to any stimuli. It requires airway intervention, meaning that the patient would require intubation and the cardiac function would be impaired. So, general anesthesia can be achieved through a combination of inhaled and IV substances, including propofol, ketamine, thiopental, methohexital, etomidate, sevoflurane, desflurane, and isoflurane. The indications and contraindications are the same as deep sedation. With that said, it's vital to remember that general anesthesia in a hospital setting is an important option for patients with special healthcare needs at ASA levels 3 and higher. It allows for comprehensive monitoring and immediate access to medical support in case of any complications during dental treatment. No matter the level of sedation, it's very important to follow NPO instructions to minimize the risk of complications like aspiration and ensure the procedure goes through safely and smoothly and maintain patient safety throughout the sedation process. So let's dive into some pharmacologic strategies that are used regularly in pediatric dentistry. This includes nitrous oxide sedation and local anesthesia. So, nitrous oxide sedation is indicated in patients with mild behavior concerns or dental anxiety. The minimum alveolar concentration, or MAC, concentration required to induce immobility in 50% of patients is 105% for nitrous oxide. In the majority of children, a concentration of 30 to 40% is effective. However, some may require higher or lower concentrations depending on the individual response, and that's why nitrous oxide is titrated to effect, allowing the provider to adjust the dosage to achieve optimal sedation while ensuring the patient remains calm and cooperative during the procedure. Contraindications would include infants under 2 years old, uncooperativeness as they will not be inhaling through their nose, or susceptibility to wheezing episodes. Mild to moderate asthma is not considered a contraindication, and this is often a board's question. Nausea is the most common complication of nitrous oxide inhalation, and it's recommended that patients are NPO, nothing by mouth, for at least 2 hours before nitrous oxide administration. Additionally, another complication that may occur is diffusion hypoxia. Diffusion hypoxia refers to the phenomenon in which the lungs fill with nitrous after stopping the flow of nitrous in the air. For this reason, it's essential to flush with 100% oxygen for 5 minutes following the procedure. So, local anesthesia is a technique we use with all of our dental patients, but in children, this differs due to anatomy, metabolic capabilities, and size. The recommended dose of anesthetic for children is 7 milligrams per kilogram, and this applies for both lidocaine as well as articaine. A quick review of innervation of primary teeth. All mandibular teeth are innervated by the inferior alveolar nerve. For the maxillary teeth, the molars are innervated by the posterior superior alveolar nerve, and the anterior teeth are innervated by the anterior superior alveolar nerve. In general, children's bone is more porous, so local anesthesia can be very, very effective. So let's jump into some questions. So, example one, a patient does not produce a response to any stimuli, which represents the sedation level that this patient is likely experiencing. So, take a moment to pause and think about this question. So, the correct answer to this question would be option D, general anesthesia. General anesthesia is when a patient is unarousable when no response is produced to stimuli, and even if that stimuli is painful. Example 2 states each of the following is a contraindication to nitrous oxide use except one, and which is the exception. So the answer to this question would be option C, which is dental anxiety. The contraindications to nitrous oxide use would be a patient that's under 2 years old, an uncooperative patient as they likely will not be able to breathe in and out through their nose, severe COPD or uncontrolled asthma or wheezing. So, to summarize what we learned today, we discussed different levels of sedation, including minimal, moderate, deep, and general anesthesia that can be used for children. Additionally, we used different pharmacologic strategies, including nitrous oxide sedation and local anesthesia. Thanks again for joining, and I hope you learned a little bit about pharmacologic interventions for pediatric behavior management today. Thanks, see you next time.